If a colleague shouts at me in front of the patient, that is certainly not acceptable, but I would not respond to it in the moment. I would keep quiet. I would not respond. I would not shout. I would not protest in front of the patients because the patient's trust in the healthcare system should be maintained. This, however, does suffer a blow when they witness a doctor shouting at another doctor. So that is a concern in this situation, apart from the obvious fact that it is not okay to shout at your colleague. But in this case, patients also begin to lose faith or start developing doubts about the quality of the care that they are receiving. Now, it really is besides the point whether the shout that I was shouted at because of a mistake or without making a mistake. The very act of being shouted at in front of the patient is not an acceptable thing. So I would definitely try to get an opportunity to talk to the senior colleague in question, and I would politely like to tell the person that whether or not I made a mistake, it was not okay to shout at me in front of the patient because it really does um, shake the trust of the patient in the healthcare system. And it is also not a very correct way in which he should be behaving with a colleague of his. Even if this conversation results in him acknowledging his mistake and apologizing, then that is a very okay situation. Also, I would take into account whether this person is doing this regularly or it is a one-off event. um, if it's a one-off event, I would also try to understand why he reacted in that way and provide the support that is necessary in that regard. But if it is a regular event, then I would also try to highlight in this aspect to him in a very polite manner. If he is not reacting, if the person is not reacting in an appropriate manner to me pointing out that he should not have shouted at me, then I would probably talk to another senior colleague, preferably somebody at the same designation as him, somebody close to this person who shouted at me. And if no action is taken, if no redressal is instituted, then I probably will talk to somebody in the HR. I'm sure there would be appropriate authorities present in the organization who I can talk to about this experience because it might be quite jolting for someone like me who was shouted at in front of the patient. Ideally, I would want the issue to be resolved with the person who shouted at me in an amicable fashion. And if the person tells me about my mistake, I would be happy to learn from them, but they should also be able to acknowledge that they should not have shouted at me. That was not the right way in which they should have reacted. And I would definitely apologize for my mistake, but they should also apologize for shouting at me. And if this does happen, I would also go and reassure the patient, preferably in the presence of the consultant, that we had a difference of opinion, but the quality of the care that the patient is receiving is not getting hampered or not getting compromised with in any shape or form.